Hello, this is Lynn Holt from the UAB Genetic Counseling Program, and I'm excited today to present to you training for standardized patient education. Our objectives for this session are to explain the role of standardized patients in clinical simulation education and to also describe the UAB virtual simulated patient rotation. Clinical simulation has been used in medical education since the 1960s to provide students and learners the opportunity to expand their clinical skills in a controlled environment. It also allows instructors to assess a student's learning and progress in a controlled environment. We're able to control the actual scenarios that students have access to, the individual test results, and other parts of the session that we can't control for in the same way in a patient setting. ACGC has given us guidance that clinical simulation cases can count towards our student logbooks and can be used in the clinical training part of genetic counseling programs. This gives us a great opportunity to expand the opportunities for our students in their learning and to establish foundations to be sure that they are seeing specific types of patients that we all know are common in clinical practice. One thing to think about is the difference between role play and clinical simulations. And while there are many similarities in the sense of that you have a defined case, you have certain objectives for each of them, there are some very important differences between role plays and clinical simulations. Role plays are limited in their fidelity because they're often done with peers in a classroom environment. It's hard sometimes for students to take on a very professional role in a role play scenario, and oftentimes they're working with a small skill set that they're trying to build on in the micro skills. And often when they're working with peers, their peers will either help them or don't want to push them too far or just don't have enough experience to know what a real patient might respond to a situation. Clinical simulation has a much higher fidelity because we're utilizing usually patients, quote unquote, that are unknown to participants, in this case standardized patients. And these are folks that will have more experience and oftentimes will reflect what the true patient perspective is versus a genetic counselor playing a patient. It also, in clinical simulation, the feedback is different for the learners and it gives them a more targeted feedback based on specific goals and objectives for that student and where they are in their learning process. Standardized patients are an important part of clinical simulation. Standardized patients, as defined here, are individuals who've been carefully selected and trained to portray a patient in order to teach and/or evaluate the clinical skills of a healthcare provider. In the genetic counseling session, oftentimes we're using this to evaluate a student's ability to assess clients' understanding, to convey test results or help them with decision making, to address psychosocial issues, and how they overall manage a session from beginning to end in many cases. Standardized patients are oftentimes the same person that serves in that patient role for multiple students, and this way the student has the same learning experience as their peer with the same indication for referral, the same challenging psychosocial issues, the same test results, and so we can evaluate students on an individual basis with a shared common experience between their peers. Standardized patients are important for providing patient histories. Standardized patients can convey the emotions that are common for a patient as well as communication styles. And standardized patients are also trained to communicate the common concerns for the indication for referral of the session. Student safety is an essential part of clinical simulation, and it is one of the pillars of clinical simulation. In order for students to be willing to take risk and engage with us, they have to know that their confidentiality will be maintained, that people won't talk about how they perform in the simulation to others. Our community is very small, and it's possible that you could have a student and then maybe that student applies for a job later. And students are really sensitive to wanting to put their best foot forward, and in order for them to be, again, willing to take risk and to do a session without being overly nervous, they have to know that the standardized patient they work with are going to keep the information from the simulation how they did confidential. Professionalism is very important in this scenario, and then of course one of the things that we constantly think about in simulation and reassure our students is that we're not here to deceive or trick the student. So we're transparent, we provide them information that they need to be successful, and we don't purposefully try to trick them into a way that will make them uncomfortable. We also have to be conscientious about FERPA, which is the Family Educational Rights and Privacy Act, which is similar to HIPAA for students. And in this, we have to be mindful that we cannot post images or videos or students without the student consent. That's why all of the videos created through the SP virtual clinical training will be maintained in a confidential way. And we can't discuss students' performance outside of the classroom setting. So it is possible that a supervisor or someone may ask you about a specific student and how they did, and that's okay. But to discuss it with others outside of that setting or with the peers, your peers, sharing about an individual student, especially by name, would be a violation of FERPA. So again, it's a great way to think of this as HIPAA for students, if you're not familiar with FERPA. Just like student confidentiality is important, SP confidentiality is important too. So we will respect that. We won't discuss how you perform or how you interacted with any students. We're not going to share videos of you without your consent. And so we just want you to know that we appreciate you volunteering to participate with students. We know that it comes with anxiety as well on the part of SP sometimes, and we're very mindful of that. And we want you to know that we're going to respect your confidentiality and would no way share your image or video of you with anybody else, especially without your consent. And we're so appreciative that you're willing to offer this learning experience with us for our students, and we thank you. Another important pillar of the simulation setting is the fiction contract. So we know in simulation we can't make it exactly like a clinical setting. And so we have to agree to accept the limitations of the simulated environment. And we have lots of variables in our virtual simulation that we have to kind of work through. Students are expected to accept the simulation or fiction contract as well as our SPs. And we want the student to assume the role of genetic counselor as an authentic and professional manner. Again, this is what makes a difference between a simulation and a role play often. And we also need the SPs to come into the session as a patient and from a patient perspective in that authentic manner. And the relationship in the beginning to be professional student role as well as the SP in the patient role. We always remind people to not let the limits of the simulation limit your learning, because if you get focused on all of the limitations and how it's not just like in clinic, then you miss a great opportunity to focus on the learning and the communication that can happen in medical simulation. So SPs, while they're responsible for lots of different roles and part of the learning, SPs are not responsible for giving feedback to the students. So in this situation, at the conclusion of the simulation, SPs will not be giving any feedback to the student about how they did, what they did well, or what they did not. Of course, you can encourage them for completing the simulation. You can encourage them for participating in genetic counseling training and adding to the field, but you're not to give specific feedback about the way they performed during the simulation. We have supervisors that are serving in that role. Just to know that supervisors may watch in real time, or they may watch the video later as a recording. And the supervisors, if they are watching in real time, it's because they want to give feedback right away. And SPs are to come off of the call before the feedback session of the simulation takes place. This supervisor will also not interrupt the session, provide cues, or answer questions during the simulation. So during the simulation, the the supervisor is just an observer. After the simulation, the SP leaves the call and does not stay for the feedback section of the session. Here are a few important things to remember as an SP and about medical simulation. These activities are high value in the sense that it gives the students the opportunity to practice important clinical skills, but they are low stakes. Students are not going to fail their clinical rotation. Students are not going to not get to graduate because of how these go. So really it's more value and less risk. And we don't want anyone to feel like they're pressured to perform in a way or that they're making or breaking a student's career. This rotation is also a pass-fail rotation based on all of the different variables that we have going on. So students really should maximize the learning and focus less on the grade that might be associated with it. I think it's also helpful if you remember and use your empathy skills back to when you were a student and what it was like when you were going through this part of your clinical training and all the anxiety that goes with that, and to think about that when you're working with the students and understand what their frame may be as they're coming into this process. It's also important to remember that there's no right or wrong way to play a role. So, it's as long as you're authentic in that patient role, that's what we're looking for here. And again, student confidentiality is very important. And we've already discussed that in detail in the past, but just to always keep that in mind as you work with a student. And to reassure them if they have any questions that you're not going to discuss this beyond their activity. Here's some tips for success as a standardized patient. It's important to remember to review the case closely. To be accurate and consistent each time you portray the case. That way the learning environment is similar between different learners. You don't need to embellish the case, and you should maintain your role throughout the encounter. So don't break and all of a sudden flip into a genetic counselor role or a supervisor role to stay in that patient role the whole time. And it is helpful to sometimes incorporate aspects from your own life when they don't distract from the reality of the simulation and maybe fill in a gap based on what question that a student asked. You don't need to think of these cases as a script that you have to memorize. This isn't a theater production. It is, again, a patient encounter. And then also, please be mindful of your self-care. These cases, let us know if they hit too close to home and they're not a good fit for you, and we can always make adjustments based on your needs. So this wraps up a very brief overview of what it's like to be a standardized patient and what the responsibilities are. If you want more information, there's an article that I've listed in the references section that can give you some information about standardized patients in a bigger picture of how they are used in clinical practice. But the main points to remember here is that we are using them for genetic counseling simulations to help our students have the opportunity to address some of the common cases that you may see, in this case specifically in the prenatal setting. And you can use your personal information and reflections on what you've seen with patients to help you in your SP role, and we are very appreciative to everyone and everyone that has chosen to volunteer to help us provide this educational opportunity for our students. So now let's move on to the next section, which is going to be about the actual simulation encounters that we have planned for the students. The UAB genetic counseling students are going to be participating in a virtual simulated rotation. Specifically, in this case, it's going to be focused on prenatal cases. And it'll have many of the principles of telemedicine with using the computer to interact with the patient, in this case is SP, and to use video conferencing so you can see each other as well as hear each other during this process. So your available resources, we have developed a standardized patient information sheet. We also have developed a casebook with case and standardized patient information. And then, of course, Jessica and myself are both available if you have any questions or concerns. And our contact information is provided at the end of this presentation, as well as within other information that we've provided. This slide gives an overview of the 10 prenatal cases that we've developed for this rotation. This is provided to you as well and the student. As you'll see, we have the patient age, gestational age, their indication referral, and then previous test results. Each of these cases has additional information that we will walk through as a case example next. So here's case 1, and this gives you this is what the student sees for each of the cases. So a paragraph description of what the current status of the patient is, their indication for referral, whether or not they've had their ultrasound or not, and then the relevant family history and medical history that will be important to them as they evaluate the case to prepare. Here you'll see examples of the notes that the SP will be provided about this case. This helps the SP to get in the frame and to understand the context of the patient. So it basically creates the backstory of the patient. It's important to know that as an SP, you should not embellish this information or go off on tangents when doing the session with a student. It is okay, however, to fill in gaps to move the session along. So for example, if the student were to ask you if you have other brothers and sisters, that information's not here, but you can pull from your personal life and say, yes, I have 2 sisters, just to move the session along. As an SP, though, you shouldn't add additional information that may confuse the student, like I have 2 sisters and one of them has a heart defect, because that'll lead the student down a tangent that's not part of the learning objectives for this case. So again, use this information to help you to get in the mental frame and character of the individual patient to how to set the flow of the session with the student. In the SP role, you should follow the student's lead in exploring psychosocial issues. So you have information in the backstory that the student doesn't have. And it's important, again, to follow the lead of the student. And if they don't address a psychosocial issue, it is not your obligation to bring it up with the student. So for example, if the student's doing decision making, you know based on this history that your character says, I always have trouble making decisions without my husband. But if the student doesn't ask you about your decision-making process, you shouldn't add this information on top of it, or out of context just all of a sudden interject this. So you are not responsible as an SP for providing all of the psychosocial information. The psychosocial information is available to you to follow and fill in as the student works through the session and those important counseling issues that we know are important in genetic counseling. You also, as an SP, should not help the student if they've left something out. So here's our example of, say you get to the session and the student didn't mention a specific type of testing that would be indicated in a situation. An easy way to help the student to remind them would be to say, I've heard that there's some other types of testing. Do you know anything about them? And how this disrupts the student's learning is it enables them to fill in a gap that they should have known themselves, and then when we go back to give them feedback, it's hard to work out whether the student would have gotten to it on their own or was it a content area that they missed and they need to work on in their future training as an objective to be sure to cover. So again, as an SP, you have more information than the student has, but you're not obligated to share all of that information, and you should share it based on the information and questions that the learner asks you to build the session as you move through it. Here's some important reminders about some of the limitations of the simulation. Again, thinking back to our fiction contract, students do not have a complete chart or access to an electronic medical record. So they are prepping based on the paragraph and the medical information that we have provided to them, and that's all they have. Because we want sessions to be limited to 30 minutes, students will not collect a 3-generation pedigree. Students are to use the relevant information in the session. However, if a student doesn't, you're not to prompt the student or ask them leading questions to get them to include that information. It's important to start your session in character if at all possible. And like I mentioned, don't prompt the students to fill in gaps that they may not have addressed. And our goal is for these sessions to last approximately 30 minutes in length. This is not a hard and fast number. If the student's done in 20 minutes, that may be all it takes. But these are not sessions that should last for an hour. We really would like for them to be on target at around 30 minutes, but you don't have to cut the student off at 30 minutes if they're not done yet. So let's talk about how these sessions are going to be scheduled next. So the cases are based on SP's availability. So it's important for you to share with us what time commitment you have available to do this. Now remembering that the cases are going to be approximately 30 minutes in length, I would probably give 5 minutes plus or minus on the beginning and end of that to get things set up and going. Ideally, we would like the same SP to do the same case to increase the fidelity of the experience. So you do not have to learn all of the cases, and you're going to be assigned a specific case ahead of time, so you know I just need to prep for case 4, and every student that contacts me is going to want to do case 4 with me. Or I'm going to do cases 4, 5, and 6 because I have a little bit more time, and every student that contacts me is only going to be asking me about cases 4, 5, and 6. So you won't have a student call and say I need to do case 1 or case 6 or case 3. It'll be very specific. And again, if we have the same SP do the same case with different students, then we're controlling for the patient as well as the clinical case, and then we can more focus on actually the student's performance in the case with a minimum number of variables as we work through. So the information that the students are going to have, of course, they're going to have the case information, but they're also going to have SP contact information. And so please share with us a preferred way for you want students to contact you, whether by phone or email, and what those numbers are. And please be mindful to respond to the students in a quick basis because we are on a deadline to get these sessions done by April 24th in order for students to graduate on time. And the students will also know what cases each individual SP has been assigned to help them focus on who they need to contact. Students are responsible for all scheduling, so you are under no obligation to contact any student to figure out what their schedule are. That is the complete responsibility of the students. Students are also responsible for communicating with their supervisor about the preferred method of supervision. So if the supervisor wants to do it in real time, then the student is responsible for scheduling a time that works for the student, the SP, and the supervisor in order to facilitate that. Students are also responsible for sending out all Zoom invitations for the individual sessions. So as I just mentioned, we will be using Zoom to conduct these sessions. The Zoom is going to be conducted via Canvas, which is our learning management system. This is a confidential student portal. This will prevent the meetings from being hopefully accessed by people outside of the learning system. And so in order to do these sessions, both the student and the SP will have a webcam, and you can either use that audio or your phone for the audio to conduct the sessions. But again, the Canvas is a learning system. You don't have to have an account with Canvas. You don't have to know anything about Canvas. But that's the way we are protecting student confidentiality. And then all the Zoom invitations will come from the student and will be automatically embedded in Canvas. As mentioned earlier, these cases are cases that we are going to use potentially for student logbooks and to meet the clinical training component of the genetic counseling program, and as such they must be supervised. So as we mentioned earlier, supervisors may join in real time or could review the video at a later date. And the supervisors will provide all instructional feedback to the student based on the case, and the SP does not need to provide any feedback, and it's unlikely that a supervisor will contact an SP to get additional information for feedback on the session. Your feedback is very important to us. We currently don't have a formal structure to collect feedback, but we would love real-time and informal feedback about how things went well, what areas we could be more helpful in, and potentially areas of improvement. It's possible that we continue to use this clinical training model as we move forward with developing the genetic counseling program, and so that's why your feedback is so important to us as we continue to look at ways to expand clinical training opportunities for our students. As we come to the conclusion of this presentation, I want to be sure that you have our contact information. Here you see myself, Lynn Holt, and Jessica Denton, the Assistant Director, our email as well as our phone number. Please feel free to call or email us any questions, concerns, ideas, things that go well. Like I said in the previous slide, we welcome your feedback and want to hear from you. Congratulations on completing the UAB Genetic Counseling Program Standardized Patient Training. Your next steps are to email Jessica Denton that you've confirmed your training, as well as attach your CV to the email for our ACGC annual report. So finally, thank you. This is a picture of Birmingham if you haven't been here before. We really appreciate all of our volunteers that support our students, that continue to support our program. And we're thankful that you are making time in your busy schedules to be a part of our student learning experience. And here are my references, some articles if you're interested in reading a little bit more about medical simulation. Again, thank you and have a great day.